Hello, and welcome to this event for pharmacy professionals. Before we start, there's just a weeny bit of housekeeping. So you'll notice that your mics and cameras are off. So that's because we're recording, and we would need to get consent from everyone if we were to have those on. But what you can do is communicate with us through the Q&A button, and then upvoting your favourites. So you'll see that there's a little option for you to kind of click on questions that have already come through that you think, yeah, I want that answering, and we'll be monitoring that throughout. So then we know what to prioritise when it comes to answering the questions. So if we move on to the next slide, and the following slide. Super. Okay, so welcome. It's fabulous to see so many people joining from the profession today. So I'm Debbie. I'm a primary care pharmacist by background, and I'm also an academic. And so my role, my official title is Professor of Behavioural Medicine. So my main role is working at a university, and I spend half a day a week working in a GP practice. Now, at the university, what my role looks like is largely leading research. And I do some teaching as well. So for example, just last week, I was running a CPD course on behavioural science for health and care professionals. So I had people in the workforce who are thinking about using behavioural science to change practice. And over the years since qualifying, my kind of balance between clinical practice and university has evolved. The other thing that I'm doing at the moment is leading the NIHR supported incubator for pharmacy professionals. And I'll tell you a bit more about that in a moment, but there is a QR code there for you to go and visit if you haven't had a chance to look into the pharmacy professionals website. Next slide, please. So this is the plan for today. We're obviously talking about research career in the pharmacy profession and what that can look like, how to go about introducing research into one's career. The plan for the session is very much for it to be tailored to your needs. So please do that, use that Q&A function throughout. So you don't have to wait till the end. Use it throughout as ideas pop into your head, and we can then pick those up at the end. We do have some short talks from pharmacy professionals who have embedded research into their careers, and they're pharmacy professionals from varying backgrounds. So hopefully that will inspire you to think about how it might relate to you and your work. But I really can't emphasize enough, this is totally safe space. Please feel free to ask those questions, even if you think it might be a silly question. Chances are someone else has thought it as well, and it gets those answered. Next question, please. Next item, sorry. Right, so before we start, I thought it'd be useful to get a feel for who's in the room and what brought you here today to attend this session. Michael, would you? Yeah, fab, thank you. So you'll see that there's a poll running. Hopefully you can fill it in. I can't see the results of the poll. Michael, can you? Ah, fab, got them. All right. So we can see we've got the slight majority joining because they're curious but don't know where to start, and that's a really fantastic place to be. So it means that you're already thinking that actually research could be the right way forward, and hopefully we can today, with the colleagues in the room, can give you that direction in terms of where to start. We've also got people who are excited and definitely want it to be a core part of the role. So absolutely, we can give you those kind of answer. There's maybe a few unanswered questions that you may have about how to go about it. For those that are feeling intimidated, I think it's amazing that you're here, and really exciting, and hopefully we can. The point is of today is to dispel those myths about it being intimidating, and actually this is something for everybody, and there are all sorts of ways in which we can engage with it. Okay, next slide, please. Okay, so I thought it might be useful to talk a little bit about myself and my path, and you'll hear from others as well. So for me, I very much stumbled into research. So I wanted to be a pharmacist. That was where I was going. And then in the final year of my undergraduate, somebody approached me, and it was the Royal Pharmaceutical Society at the time were funding PhDs. And they said to me, "Oh, would you fancy a PhD?" And I was like, what is that? And I thought, a PhD, that was all about working in labs and things. So I was like, I'm not really sure. And then I went on, did my foundation training as a community pharmacist. They came back to me again and said, "Oh, look, there's this opportunity." And I thought, yeah, why not? Why not? Nothing to lose. And what was amazing was they were really clear that when you do this PhD, you will continue to practice as a pharmacist. There is no point in stopping that. Otherwise, your USP, the fact that you understand pharmacy, you understand the issues that coalface, disappear. So I felt like I had nothing to lose. And so that was how I embarked on this PhD, continuing to practice as a community pharmacist. And then when I was doing my PhD, one of my fellow PhD students was doing a project about could pharmacists actually work in primary care? Might there be of some benefit? And what might that look like? And this was in the late 90s. And so as a part of their PhD, they were trialing working in a GP practice. So I then got to trial working in a GP practice and have never left. So I then transformed into being a primary care pharmacist and have just continued. And so the PhD, the kind of research bit actually took me into a new sort of clinical path. So that just kind of rumbled along in the background. My academic path, that kind of slowly evolved because I think there were very, very few pharmacists at that time who were research active. And over time, I started to work out how to write grants, and then kind of got a few multi-million-pound grants in. And once I did that, eventually managed to then get myself to professor. So that was really my path in terms of the clinical and academic. And then there was a personal life in between. So that year when I finished my PhD, started a new job, got married, oh my goodness, that year was hellish. But things have stabilized, and I sort of had that beauty of being able to flex between sometimes my profile being more academic and other times being more primary care based. So I've got a family, twins came along a few years ago. So it can be done. It is harder as a pharmacist at the moment. We don't have the traditional pathway that others do. Other health like medics who have a formal clinical academic pathway, but we are getting there. Next slide, please. So the reason we are getting out and we need to get there is the Department of Health and Social Care have made it clear that a workforce that is research active is really important. It should be a core part of everyday clinical work. And that's, I think, something that really is a driver now for the pharmacy profession to think about how we can fulfill that. So if we move on to the next slide, we can see that it has always been a part of our role. So if we look at our pillars of practice from the Royal Pharmaceutical Society, we've got clinical practice, leadership and management, education and research is there as one of our pillars of practice. But we know the reality of how that is managed by employers, by our line managers, is that it hasn't historically been given the same weighting. But the Department of Health and Social Care has said this needs to happen. It's no good if we continue practicing like this, where we're focusing just on service delivery and not thinking about research. So things do have to change. Next slide, please. So I guess the question is then why? Why does it need to change? And when we ask clinical academics, when we ask pharmacy professionals, the most common thing they say in terms of why should we do research, they say it's for patients. If we move to the next slide, the key things they say is it's so that we can improve the health outcomes for patients by improving the services that we deliver and the care that we provide. They also identify other benefits. If we move to the next slide, people that have engaged with research, and when we talk about in clinical academics, we can see the most common response that they give us is that in addition to the patient benefit, it's a chance for their own professional development. It also really allows them to collaborate with other healthcare professionals, and that in turn just improves job satisfaction. And then from the employer perspective, they're saying, well, when my team are satisfied, then that also improves staff retention. So there are benefits to employers and to the individuals as well. If we move to the next slide. So when we think about benefits, it isn't just that touchy-feely, warm, fuzzy feeling. There is actually new income to be had. And it's a lot. There's around 5 billion that's invested in applied health research, and it's across various sort of streams. So we've got research infrastructure so that we can actually deliver research. We've got direct funding of research studies, and then investment in research training and career development. And we'll talk about some of those opportunities at the moment that we're not really accessing as pharmacy professionals. So if we move to the next slide, the two key ways in which we as pharmacy professionals can get a piece of this pie, this 5 billion, is either delivering research or leading research. And I think when we talk about research, often people think, oh, I've got to write a grant and I've got to then lead this research team. Doesn't have to be like that. The other way is to deliver research, which can be really exciting. So essentially that means recruiting patients to studies, and then you get paid for every patient recruited to a study. Or you may be trialing a new way of working, a new drug or a new intervention within community pharmacy, primary care, and then you get paid for doing that. So that's new money. It's enrichment of the job role. So that's the delivering research. And then there's that more traditional idea of research where you're writing a grant and therefore you fund your own time, so your salary gets funded, you get protected time to then do the research. You can also embed funding into the grant for training yourself, training other people in the team. So they're the two main ways in which we can access that pot of funds. Next slide, please. If we look at the workforce, pharmacy is the third largest healthcare profession. But in terms of research capacity, it's a really different picture. If we look at the next slide, we're way, way down the list. So you've got, in terms of research capacity, you've got medicine that is very much taking a big piece of that pie, that 5 billion. Then you've got nursing, physio, and pharmacy a long way down. So we have some work to do as a profession. If you look at the next slide to give you a flavour, and I've talked about how some of the funding, that 5 billion, is available for research training. One of the offerings from the National Institute of Healthcare Research is doctoral fellowships that we'll talk about in a moment. And if we look at applications for doctoral fellowships from pharmacy professionals over the last few years, only 3% come from pharmacy professionals. So the vast majority are from medicine. but then we have other AHPs too in that mix. And then our success rate is also quite low, which is reasonable. If we're not really submitting, we're not getting that learning about works and what doesn't, and so our success rate is also quite low. So there is work to be done, but there are opportunities to be had. So if we look at the next slide, one of the things, the exciting things that happen is the NIHR is investing in us as a profession. So they have funded the incubator for pharmacy professionals, and that was launched in 2024. So it's 150k, which is not much, but it's invested just for us as a profession over 3 years to understand what it is that's stopping us from engaging with research, what can help us, and then having understood what the issues are, to actually develop strategies to address it, so that we're no longer right at that bottom of that list in terms of applying for funds. So if we look at the next slide, this is what the incubator is. This is a team. So we've got a diverse group of pharmacy professionals that are leading the incubator over the 3 years to identify what our key challenges are and then develop those strategies. And Richard Bourne is one of the people today who will be sharing his story about how he's developed his research career. If we move on to the next slide. So the incubator, as I said, was funded in 2024. We finished in December 26, so we're on the home straight now. And what we've done over the past 3 years is, the first year we spent understanding what are the barriers and enablers to us engaging with research. So we did some focus groups first with pharmacy professionals from all the different disciplines. We then did a national survey, and then from that we prioritised the key things that need addressing. We then co-designed solutions, so we did online co-design workshops with pharmacy professionals, and now we're in the final year at the stage of actually implementing those solutions. Now, I'm a behavioural scientist. If we move to the next slide, behavioural science underpinned that. So we can see how research really can be embedded into all aspects of our life. So if we move on to the next slide, there were 9 things that we found we need to address within our profession. So here they are. These are the things that we prioritise for addressing. Just give you a moment to look at those. If we move to the next slide, this is what we've now designed. So there are 4 key components to support pharmacy professionals to engage with research. We're developing a national network for research that will have peer support, so that you can see how others are doing and learn from each other and not feel like you're out there on your own. And by doing that, people can share stories about the benefits of research. You can find out what sort of research others are doing, so an opportunity to be able to present your work. And then the personal benefit that people wanted was the ability, to be able to present their research and for people to see what they're doing, rather than just doing this in individual silos and no one being aware of it. Also providing practical support to actually develop your confidence in undertaking research. Then the last 2 bits is us working at quite a strategic level, so that the pharmacy employers are also aligning with this narrative of, yes, we are supporting you to do research and it is important to us. And similarly, and as a professional, we feel that 5th pillar, that people recognise it's there, that research is part of our role. If we move to the next slide. So that's what's happening from the incubator's perspective. So we're developing things that are bespoke for our profession. The NIHR also has a number of offerings to support healthcare professionals, health and social care professionals, to develop from that stage of, I really don't know what I'm doing and I don't even know if this is for me, right through to chair which is professorship level. So I thought it would be useful to have a look at those first three boxes today: that initial experience, getting prepared for being able to submit a strong application for a doctoral fellowship, and then the actual doctoral fellowship application. So if we look at the next slide, so that initial experience, there are two things that are available to us. There's the insight and then the internship program. So the insight is where essentially you're funded to do a master's. So if you think about those barriers and enablers to pharmacy professionals engaging with research, one of them was lacking in confidence to be able to do research. So doing a funded master's as an early career pharmacy professional, the intention is that then gives you the confidence, because you will have done it in your early training, some bits of research or audit perhaps. This is kind of now saying, right, look, you can actually do this. Here are the skills that we're either giving you some new skills or refreshing them. And then the other thing, so that's for people who are recent graduates. And then for those that perhaps further along in their career who are now thinking, maybe I fancy doing research, we've got the internship. So the way it's configured is people tend to get backfill for, say, a day a week for 2 to 6 months. And during that period, they get to have a go at doing some research. So they start to form some links with local researchers, maybe do a little bit of training for attend a conference, do a mini project. So it's just giving them a flavour of what it might look like. Okay. Next slide, please. Please, if you've got any questions or comments arising from this, please do put them in the Q&A. So now let's assume you've done your taster, or you've got to fit, you're kind of thinking, yep, I want to go down that formal route of research leadership, where you're writing your own grant. So now you might want to do a pre-doctoral award. So that's open to pharmacy professionals, registered pharmacy professionals, and this gives you up to a year of protected time to maybe do masters if you haven't already done one, or some other bespoke training, because in your doctoral application you might, for example, I'm a behavioural scientist, you might know you're going to need to use behavioural science in your PhD, so you might decide to do some underpinning training. And so this pre-doctoral award will support that. It will support you to maybe to write a little do a little project and write a paper. It will support you to get your patient and public involvement team together to start building your doctoral fellowship application, and some supervision fees. So that's the pre-doctoral world. And then by the end of having done that, you should then be in a position to put together a strong competitive application for a doctoral award. If we move on to the next slide. So the doctoral award then, this is, I think it's living the dream. So think about how I did my PhD with a £9,000 stipend and locoming in my lunch breaks and evenings. I think this is salaried time. Whatever your salary is, they will, match that. So it's salaried time, doing a PhD. And so you could be 3 years whole time, or you can do, varying levels of part-time, pay your PhD fees, pay for the research, pay for your patient and public involvement team, pay for your training. I mean, amazing, living the dream. So that's that pathway to moving to research leadership. I would stress that to do this, this is why you need the earlier bits of support, because you do need to get a strong supervisory team to be able to put in a competitive application. Moving to the next slide. So now we move on to the main bit of the session, which is our pharmacy professionals. So we're going to hear first from Arvind, and then Abby and Richard. So Arvind is at the pre-doctoral stage and a community pharmacist, and I'd be delighted to hand over to you, Arvind.
Thank you very much. Can everyone hear me? Is that okay? Fantastic. Thank you very much, everyone, for attending. Next slide, please. So those are that's my contact details. If anyone's got any questions that they don't want to put in the chat, or they just want some general advice, but just bear with me because I do I am a community pharmacist full time at the same time as well as doing the research. So my inbox does get very clogged very quickly. Please bear with me. I will respond. Um, So I'm actually an honorary member of the University of Bristol, University of Oxford, and the Chemists Stockford Chemists in Oxford. So if any of you are in the Oxford area, please feel free to come by. Next slide, please. So I thought I'd give you a quick overview of my career so far, and this is kind of how I sort of break it down, really. You do your MPharm career, you end up doing a dissertation, and that's a really very basic introduction into how research is done, but it's very monitored. Your supervisor tends to very much decide your sort of topic and gives you a very gentle introduction. And some of you may have been lucky to have some of that stuff published. Some of you may even have a poster or something like that. I did mine in computational chemistry, so absolutely nothing to do with patient experiences or anything like that at all. But it was great. I had a really good supervisor. Um, so that was done, did my pre-reg exam, and then there's that awkward period between becoming on the register um, and you passing the exam. So what did I do? I got a job at the CRN, so that was the Clinical Research Network. I think it's now known as the RDN, the Research Design Network. Um, and I'll be honest, I got lucky with that. I just happened to know someone who was saying that, oh yeah, they're looking for people, and I just thought, you know what, I'll do it. I'll just fill my time, make some money while I wait for my registration to come through. And that's pretty much where I built a rapport with some of the clinicians there who are running these trials. And you form these really interesting relationships with them in terms of you kind of have always having like a pally conversation is how I would describe my interaction, certainly. Um, and you just get talking. And it was one of these clinicians that was the sort of real driver for me getting into a research career. And so I teamed up with him just after I qualified, and he said to me, "Oh, we're thinking about introducing pharmacists into free access liaison services." So I said, "Yeah, sure, why not? That sounds like fun." I was like, "Have anyone done the role before?" He's like, "No, we're just going to create this just to see what happens." So I ended up doing part-time locum work, part-time FLS work, and still running my research at the same time. Around that time, I helped co-author a paper on vitamin D supplementation. At the same, going to conferences with the FLS team, writing reports and audits and all that sort of stuff. Um, but it's these gradual sort of steps that lead you into a almost falling into a research career. And then I saw that PR UK, so that's Pharmacy Research UK, they had a grant out for people wanting to do research, and I thought, you know what? Um, and this is actually quite a really awkward story, but I'll tell it anyway. I got one of those circulars through in the mail from Oxford University because I'm actually I'm based in Oxford, and it was CPD courses, and these were typically things like adult learning courses, languages and such. But there was one that I thought stood out a bit, and that was evidence-based healthcare with medical statistics. And I thought, you know what? As someone who's becoming more and more involved in the research side of things, I don't actually understand what any of these numbers mean. I don't even understand what the methods mean, really. All I know is that they're producing a number, and I'm just having to almost interpret it in some way to try and put it together. Um, so I again got very lucky. I managed to get my PR UK grant, and that funded my MSc at Oxford. Um, and while I was doing my MSc at Oxford, I attended the Bone Society Research clinical training course. Um, and that's when I met a rheumatologist from Bristol who was designing a clinical decision tool to look at vertebral fractures. And pretty much that led to an Royal Osteoporosis Society grant. Um, and off the basis of all of that, I then thought, you know what, I'm pretty in deep at this stage. I really ought to do something with all this research experience. So then I applied for the pre-doctoral clinical academic fellowship and again got very lucky with that. So here we are. Next slide, please. So this was one of the questions that was asked of us, the keynote speakers. Um, and so what I thought I'd do is I'd address it in the professional side of things and the research side, and then the personal side, because I think for me it sort of makes a bit more sense. So if we go to the next slide, please. So in terms of our professional development, I'll tell you the one thing, research makes CPDs so much easier because there's always going to be a new method, a new understanding, a new interpretation of the statistics that are going on in the space. So for me, that was a massive positive. But also you find your approach to work becoming more systematic. You tend to be able to identify what's relevant and how to measure what it is you're looking for. And that's one of the big changes. And these are things you don't even really tend to notice until you actually sit back and reflect about what it is you've done. Um, Problem solving becomes a lot more easier. Um, I'm very much now of the mind of planning almost like mini papers, as it were, mini projects, mini audits to try and process map everything we're doing in the community pharmacy to try and identify what we're doing, what's going wrong, what's going right. And this is really valuable, guys. I think as a community pharmacist, we tend to look for patches. We tend to bodge solutions together, and it works, and it'll keep working as long as we're there to re-bodge it afterwards. But actually, when you start digging into the research and become really surrounded in the environment, what you tend to see is you actually take a step back and think, actually, I'm already beginning to see the cracks in this solution, and I think we can improve it. So that was just a quick oversight of my professional development, at least anyway. Next slide, please. So the research side of things has been for me fascinating because, as I said, I hadn't really thought about it too much until I was asked to give this talk. But I think for me, it's my ability to intuit the phenomenon of the world, from newspaper headlines to policy decisions. Research can really help you make informed decisions. Your provision of resources and the access you have to opens up opportunities not only for expanding your knowledge of the area of interest, but also provides opportunities for cross collaborations across disciplines. And for me, that has been some of the most fun projects I've worked on has been cross discipline. So that's myself working with medics, working with nurses, working with physiotherapists, all these other professions bringing their own unique insights and ways of thinking, and actually being able to understand them and they understand you. And the kinds of outputs you get from that are, again, it's just fascinating because you think to yourself, I'm hanging around with a lot of people who are on the same wavelength as me, and as I said, that having those difference of perspective but the same common goal it's an unbelievable feeling when you really get into the swing of it. Um, but the other thing as well to remember is the grants that you get are probably one of the most crucial aspects because it gives you the provision for time and expenses. And for a lot of the time that I was working, I have to say I was doing a lot of it on my own back. So I didn't have any support in terms of funding or time. I was getting up at I was getting up at 5 in the morning, trying to write down as much research stuff as I could, do my whole work day, 10 hours, come home, have dinner, and then crack on again until about 9, 10 o'clock at night, before you finally the coffee wears off and you sort of crash a little bit. But so having this funding has actually it really does give you a great ground to stand on. Next slide, please. So the personal side of things has been, again, really interesting to reflect on. Um, I think for me, the biggest one is a sense of fulfillment you get when you take that idea from conception all the way through to publication, knowing this is something that you have done or you and your team have done. And it's something so unique that no one else has actually done it before. Another benefit for me, at least, has been it's a welcome mental break from pharmacy. Um, you tend to provide it. I mean, it's not, pharmacy in itself can be quite repetitive. The details are different, but the problems are essentially similar on a day-to-day basis. So actually having the research in the back of your mind provides not only a welcome break, but actually gives you another new perspective on how you're interacting with the world. What am I really doing? Um, what kind of insights am I getting from dispensing this drug versus that drug? Have I actually seen that many more side effects on patients saying the orange one works better? How true is that really? But one of the greatest things I found about research is that it's a sense of camaraderie and community. Pharmacy can be an incredibly lonely and isolating profession, unfortunately. Even if you're working in hospitals. I've done a year and a half in hospital pharmacy, and even though I was talking with pharmacists, you tend to be quite isolated when you're working, and that's definitely very true in community pharmacy, where sometimes you can be the only pharmacist. You might not see another one for days. You're talking, you can sometimes talk with your dispensers and technicians, but if you're working as a locum, you might not even see them ever again. So having this large untapped, not large untapped, but large community of people, again, all having that same goal of trying to push the boundaries of knowledge, it really does give you that sense that actually you're maybe not as alone in your working life as you might think. Um, the other thing I would probably say is it really does give me a sense of purpose as well. Because again, thinking about what we do in pharmacy and what are watching other people, you do tend to see people just be, they turn up to the job, they do their 9 to 5, 9 to 6, 9 to 7, whatever, and then they go home. And then the weekend comes, and then they go back to work, and then they do their job, and then the weekend comes, and they go back to work, all that sort of stuff. With research, it very much the research guides you to be very cognizant. This idea that you can't really ever stand still. You're always looking for that next thing, and you're trying to push the boundary of, is this possible? Is this possible? What does this mean? What can I draw from this sort of thing? And I think lastly, the other thing I'd like to mention is legacy. So I am someone from South Asian descent. Legacy has been a core part of my culture growing up. I'm sure some of you may be able to relate to that a bit. So knowing that, through the papers that I've published, the work that I've done, and the communities I've interacted with, knows that someone else can eventually take up the mantle of the work that I've started, which is, I think for me, is quite nice. Next slide, please. So this is just a few things of what I've managed to achieve in my small time as involved in research. My vitamin D trials paper was the first paper. You never forget your first. But as you can see, I've tried to be as open as I possibly can with what it is I'm doing. I've done courses, I've done training, I've done conferences, all these sorts of really cool things. And it's only because I've managed to get into the research side of things that I've actually managed to do any of this. If I was just working by myself, then I don't think I would have achieved half of what I've done. Next slide, please. So my future plans, I'm very basic like this. PhD, postdoc, professorship. But the great thing about research is you can start off with a very naive dream, and you can take it wherever you want. And I think that's fantastic. Nothing else will give you that flexibility, in my experience anyway. And and you can take it at your own pace as well. So I know colleagues who have taken maternity leave, paternity leave, etc., etc. And then they come back and they crack on. Some of them move into industry, some move back into primary care, but having that knowledge and the experience that you get from each of those sectors can only do you good. It really can. Next slide, please. So I think I've pretty much explained why I want to continue on a research career pathway. It's all these little things. And it's not just about your professional development, it's also about your personal life, feeling comfortable in your own skin almost, knowing that you're making a difference on a day-to-day basis, not just necessarily in terms of patient benefits, but also in your sort of in the intellectual sphere. Last slide, please. So this is my recommendations, and I think if anything, this is going to be anyone who wants to get involved in research in any capacity. This is the slide you want to take away. The supervisor you have is going to be the most important person to ever talk to ever meet. I said I've been incredibly fortunate to have had some really great supervisors. I have had some really bad supervisors as well, and knowing what that is really important. And so what I would suggest to everyone is reflect by yourself. Just literally, this is literally what I've done. Take a bit of paper and say to yourself, this is what a good supervisor is. This is what I think a bad supervisor is. These are the things I've liked about the positive supervisors. This is what I haven't liked about the positive supervisors. And go out and find these people. And some of you are thinking maybe, oh, I don't know where to start, where to find these people. Honestly, just ask, read around, see who's there, go to PubMed, put in some clinical areas that you're interested in, and just see who's around and talk to them. And if you feel comfortable talking to them, that can be a good sign to say, actually, this is someone I wouldn't mind working with. And, if it doesn't work out as in terms of a supervisory role, at least you have that person you've made contact with, and they may prove useful much further on. The other important things are your team. And I don't just mean that in your research capacity. I mean, the guys you work with at the pharmacy, for example, the guys at your home, your family, your folks, your siblings, your partner, they all form a part of your team, and they all need to be rooting for you. So that when you have this problem of, I'm sorry, I can't come to this wedding because I have a project due on Monday. I'm sorry, I can't do this. They'll say, you know what, we understand what it is you're doing. It's totally fine. And also they would also help find you opportunities. Hey, there's this group that I've spotted. Are you interested? I mean, my mother, bless her, she works at the hospitals, and she still sends me intranet emails of writing retreats that I could go to. So it's your team isn't just, when I say your team, it is all the people that are there to support you. I'm aware of time, so I'm going to quickly finish up. Resources. Research can be incredibly resource intensive. Time, and don't forget money as well. Know your worth as a researcher. Know when it is time to say, actually, I can't do this because I really need to make a bit more this month because I've got a mortgage to pay. The kids have got clubs to attend, stuff like this.
Sorry, we are really short on time now.
That's fine, and that's fine. Last thing, passion. Just make sure, because you are going to be doing this for a long time, so just make sure you've got the passion to do it. And thank you very much.
Wow, thank you. That was really inspiring. And yeah, I cannot agree more when it comes to supervisor. I think the only other thing I would throw in there is, look at the publications, look at the grants. If you haven't got a supervisor who's successfully secured grants themselves, how are they going to train you to do the same? So please do select very carefully. I'm delighted to hand over to Abby.
Hi everyone, thank you so much for having me. I hope you're all having a good day so far, and thank you, Arvin, for that talk. Absolutely inspirational. I was sat here making loads of notes myself, so I will try and keep to time as best I can. So good afternoon everyone, my name is Abby. I am a clinical pharmacy technician and research delivery lead for Sunlight Group Practice. Next slide please. Next one, that's it. So I'm here today to give you my journey and experience as a pharmacy technician, mainly involved in research delivery at the moment. So I've been a registered pharmacy technician for 12 years. Overall, I've worked in the sector for 17 years. I've worked across multiple sectors, including community pharmacy, secondary care, and primary care. I am currently a student on the University of East Anglia Advanced Pharmacy Technician Diploma of Higher Education. This has specific research modules for pharmacy technicians. So this year I'll also be focusing on my own research proposal, which I'm really excited about, and I'm taking all the tips myself on how to start. So definitely I'm learning loads myself today as well. Next slide, please. So my research journey started much earlier than I originally thought when I was reflecting, writing these slides. Many years ago when I worked in secondary care, part of my, what I call day job, was accuracy checking medication related to clinical trials. So that was either dispensing, accuracy checking. And at that point, I just saw it as, it's just another part of the puzzle. It's another piece of my job, and didn't really explore the bigger picture behind why we were dispensing those drugs. I had a protocol. This is what I needed to follow. But it was these skills at that time and that awareness of research which really helped me grow my journey in primary care. So, next slide, please. So a few years later, I was appointed as a deputy PCN lead. I was approached by one of our practices with a research lead GP for support in a commercial study that was to be delivered at practice, which needed pharmacy support for medication preparation. And it was a double-blinded randomized study. So the question was asked, can we do it? How do we do it? How do we deliver this? Because it was a really exciting opportunity. So thankfully, having that experience of dispensing and checking the study medication in secondary care, it was then thinking, how can we apply this into primary care? What best examples of practice can we use moving from secondary into primary, which would ultimately bring research delivery closer to our patients, not having to just be more predominantly focused in secondary care, especially in our area. It's more secondary care led. So we put a plan together. We upskilled some of our pharmacy team, pharmacists and pharmacy technicians who hadn't already been involved in research delivery. I was working very closely with our research nurses and our local research delivery agile team to see how we could best work together to deliver this study, which was really successful. We had a MHRA inspection during the time as well, which puts anybody on tenterhooks. And they commended the pharmacy policies and SOPs we put in place for the study. So that was a really significant moment and a pat on the back that we were doing things at best practice. So next slide, please. At this point, I was then interviewed by our local research delivery network for a newsletter. And from here, my research journey properly took off. So that's available on the Northwest RDN website, anyone who wanted to read it. Next slide, please. So last year, I changed roles again. I moved into just being GP practice employed rather than PCN at a different practice, which my practice manager sat me down. I'm like, right, we need to get research going. I was like, okay. Where do we start? I've been involved in studies. I've been involved in delivery now. I've won study commercially, but how do we raise that level? There's nobody in practice who knew where to start. So that was my job, to figure out where to start. I contacted our local research delivery network. Absolutely reach out to them if you're not already involved in research and you're wanting to know how to get started. I cannot thank them enough. They've been really supportive. We had a GP lead who was appointed as my clinical partner. We bounced off each other. Where should we go? What should we start with? Where do we dip our toe into? And it was a 6-month trial initially. And following that, I was appointed to research delivery lead for the practice, again, working alongside the GP as principal investigator. And now it's become one of the main focuses in our practice, especially from a business case point of view, because we know it's in the 10-year NHS plan. So we're now making it part of our core strategy as a practice to develop further. Next slide, please. So this led to me being the person who asks why, how, and can I? Especially for pharmacy technicians, there's a lot of talk of pharmacists getting involved in research, which I absolutely 100% implore anybody, pharmacy technician or pharmacist, get involved in research. But it wasn't always obvious that the opportunity was open to me as well. And asking that question, why, can I, how can it be possible? I asked one of our studies, the CLEAR study, which is a cervical screening, because they had made it clear that the principal investigator didn't have to necessarily be a medic. So I discussed it with our GP lead, asked for his blessing, so to say, if he'd be happy for me to be the principal investigator, if the study team agreed with it. They went away and had a think about it, and they came back and said, yes, we're more than happy for you to be principal investigator per site. So that was absolutely a moment that I just grateful for the opportunity, because it shows any profession can get involved and any profession can be a principal investigator. And there's been many pharmacists who've also reached out and say, oh, I didn't know we could do this as well. So the pharmacy family as a whole, it's asking those opportunities, can I? So this is a study that I'm currently leading on for practice. Next slide, please. Training that supported me mostly over the last 2 years has been the Good Clinical Practice Certificate. Anyone who's involved in research will know this is a staple. The RPS also co-authored some e-learning for pharmacy professionals. I found that really, really helpful, especially just making sense of research. If you're not aware of what it is initially, or not heard somebody else talking about it, it can seem this mythical unicorn, and it really nicely breaks down what research is. And then our local research delivery network delivered a 2-day local research delivery training, which I attended. Again, how to set up studies, what that means for sites, what do we need to do, the legal and ethical implications. And that was massively helpful. And informed consent training. So now in my day-to-day, I'm seeing patients in the research studies in a clinical capacity. Not the smear ones, I'm not trained on smears, but in different studies. So be it for a blood pressure check, be it for administration of medication under the protocol. Obviously, our GP lead is the principal investigator for those ones, and I'm on the delegation log for different activities, but it's having that hands-on experience for our patients as well within studies. So that's my day-to-day in research at the moment. Next slide, please. So yeah, that's a quick overhaul of my research journey so far. If anyone has any questions, feel free to grab me on LinkedIn. We do also have a research network for anybody within primary care, within the Primary Care Pharmacy Association, QR codes there, or reach out and I can link you in. But there's definitely some fantastic individuals already leading the way of research. And no question's a stupid question, like Debbie's already said here today. It's a safe space. So definitely it's there if you need any support. So thank you very much.
Thanks, Abby. Moving on to Richard now.
Thank you, Debbie. Afternoon, everybody. I think we're a bit tight for time, so I'll try and speed up with some of my slides so we have more times for the Q&A at the end. So I'm a clinical academic pharmacist, so a little bit different to Debbie in that the balance of my activities and my research activities is a little bit more spread between my clinical role as consultant pharmacist and my academic, which is a research-focused activity. And I'm currently an NIHR senior clinical and practitioner researcher. Next slide, please. So because of that, I have the following disclaimer. These are my views and not necessarily those of the NHS, the NIHR, or the DHSC. Next slide, please. So Debbie's already introduced this concept of the curricula going from post-registration foundation to advanced and consultant level practice, and highlighted that one of the domains is the research domain. Now, generally speaking, from an advanced and a consultant level practice, pharmacists generally find the research domain to be one of the most challenging. And I think that is because currently many pharmacists approach advanced in consulting credentialing later on in their careers and then discover that they haven't really maintained their research priorities as well as their clinical or leadership or educational activities. And I know, speaking to this group of people, more of you are going to be earlier in your careers and you have the opportunity to make sure research is embedded, as Debbie has already highlighted, throughout your careers. Next slide, please. Now, what I wanted to highlight is we've heard about why we should do research, but I wanted to spend a little bit more time talking about the transferable skills that Arvind alluded to, because each of those domains are not mutually exclusive. They are related, they are dependent on each other. And of course, having research skills develops your critical appraisal, your ability, as Arvind has talked about, in terms of more advanced data interpretation and analysis, but it gives you the problem-solving capability as well. And creative thinking is so important, okay? It's easy to get that suppressed because we work to protocols or guidelines and policy, but we need that creative thinking to look at things differently to see how we can improve it. And of course, we need to be able to communicate and translate that evidence that comes from the research into practice. And that comes with project management skills, leadership skills, and an ethical and a reflective practice awareness. But ultimately, research really helps us have a curiosity and a learning mindset that allows us to look at things differently so that we don't just do things because this is the way we've always done it, and it gives us the opportunity to improve. Next slide, please. So this is my linear, sanitized research career to date. And we've heard about the importance of supervisors from Arvind and Debbie earlier. And my experience of that started at an undergraduate level from a research project that I remember sitting in a coffee room talking to two of the lecturers about my findings from my undergraduate research project. And one of them saying, you should do further research. And it wasn't until a few years later that I realized, actually, that was a really good steer for me. I undertook a pre-reg project and then realized that I enjoyed that to the point that very early in my career, I went on to do an MSc in clinical pharmacy with a research element. I completed that and thought, you know, that's a really good start in terms of my research. I was working clinically within the critical care specialty. And I remember one day sitting down with the clinical director for critical care in a coffee room again. And he said to me, Richard, I'm really worried about your research. And I thought, doesn't he know I have an MSc in clinical pharmacy? And he said, I think you need a PhD. And ultimately, he was right. I undertook a very sort of convoluted way of doing a PhD well before we had all this NIHR support that Debbie has very well described. And ultimately, I completed that. And soon after that, I got accredited independently to be working at consultant level practice and got a consultant level post within critical care. I went on to do a postdoctoral NIHR clinical lectureship, one of the ones that have changed their names recently. And that allowed me to do a master's in research and public health, but gave me a broader idea of research methods and designs, including health economics. And then I went on to get this NIHR Senior Clinical and Practitioner Research Award. So within that time, I was also developed my academic status and moved through the paths there as well. Next slide, please. But that doesn't tell the story. Research is a roller coaster. It has the ups and downs, twists, and undulations that we don't expect on any one particular day. And so what I've tried to do here is show a graph of one of my research activities, which is publications by year, showing the fluctuations and trying to explain them so that you can see during a PhD, I was rather consistent in terms of my research outputs, but immediately post-PhD, my supervisor from the university retired and I lost my relationship with the university. My funding had obviously finished, my time allocation finished. And so I went into focusing on my clinical practice, as most people do in pharmacy. Your organization says you finished doing your research, now you need to go back and focus on your clinical practice. And I did. And I worked to develop a clinical pharmacy team working at an advanced level in critical care, fully embedded within the critical care multidisciplinary team, working to ensure that all our patients had the opportunity to get the best outcomes from their medicines. Over the time, I got the opportunity to collaborate with colleagues nationally within critical care, and my research outputs increased. But I realized to actually develop my research further, I needed to get project funding. And so I refocused my attempt on project funding. and personal fellowship funding to give me the time to deliver on the research. And that was then delivered through these 2 postdoctoral awards from the NIHR. Next slide, please. So I just want to highlight 2 things with this and show the transferability of research. So during the time when I was working on my collaborations, the CQC came and did a scheduled review of our trust. And they identified the clinical pharmacy service to critical care as one of the outstanding areas of practice in the trust. Within my research activity, the postdoctoral NIHR awards have given me a step change in my research, and you can see the actual evidence in terms of the outputs in terms of publications. Next slide, please. So, how has research shaped my career? It's been the foundation of my clinical and academic career. I'm obviously, from a clinical point of view, I'm working at a consultant level, and I'm fortunate to work with an excellent clinical pharmacy team and a very, very good multi-professional team within critical care that work very well together and provide extremely good care for our patients. Within academia, I've had superb mentorship, supported by the NIHR from people like Professor Darren Ashcroft at the PSRC in Manchester. I've to be able to deliver collaborations, not only nationally, but internationally, and in terms of progressing my work and my research. I have my own PhD students now and mentees that I'm supporting through their own NIHR pathways and fellowships. And of course, that's supported my critical thinking, my understanding of patient needs, and also system thinking that Arvind alluded to, my personal as well as professional growth and leadership, and then given me a continuous learning and adaptability mindset. I have to say that my biggest learning through my training from the NIHR was through their Future Focused Leadership course, which really taught me about leading self before you can lead others or leading beyond authority. And of course, having those clear goals in terms of your clinical practice and research and being able to articulate those. Next slide, please. Now, ultimately, and I think Arvind tried to sort of say this earlier, it's about understanding how research can help shape our careers. And for me, it's given me the intrinsic motivation, really what gets you up in the morning to actually make sure that you're enjoying your career. And we're in our careers a long time, so it's really important we enjoy them. It's given me a purpose. It's given me the autonomy that I can control what I'm doing when I'm doing it. And I have that mastery now. And extrinsic motivation, on the other side, can only take you so far. It can only motivate you so far with pay awards or grades of employment. For this is what you really need to keep you going. And research has given this to me, and it's important you find something that gives it to you for your careers. Next slide, please. Now, I won't spend any time on this apart from just saying this is another formula the pharmacy professionals quite like to see in terms of capability, opportunity, and motivation to create a behavior change. This is Debbie's area of expertise. I'm not going to spend very long on it. Next slide, please. But I just wanted to highlight in terms of the motivation aspect and the intervention that's been developed through the incubator led by Debbie. It's very much focused on how we as individuals can improve our capability, have better opportunities, be more motivated to do research. And of course, there is another aspect that's been highlighted by that work, which is the organizational support. The organizational support where you've got the role models, you've got the positive research culture, celebration success, and an understanding how research improves care and services that can really support you and nurture you and help you on your research journey. And it's really important as well. Next slide, please. So one of the things we saw from the poll earlier on is that people are curious. They want to know more about where they start with research. And of course, research can be very daunting. You know, you pick up a paper in a medical or a pharmacy journal and you see a very large study being done, might be a randomized control trial in a multi-center, and you think that's so far away from where I am. And I wanted to just put in this slide here, really talking about the evaluation continuum to really give you an idea of what you can be doing and where you can start. You don't have to start with the academic evaluation. And in fact, many of you may not ever get there, and you may not have to. But the local evaluation is somewhere where all of us can start, okay? It might be that it's a clinical audit done on your ward or within your pharmacy department or within your community pharmacy. and you might learn useful information from that and make changes that lead to improvements in the care or implement a evidence-based practice in your care. And then you can big and develop to quasi-experimental studies before maybe randomized controlled trials that Abby was talking about earlier. Next slide, please. So I just want to summarize by saying, research in terms of the evaluation continuum is for everybody. You can start small with service evaluations, quality improvement, clinical audits, but the important thing is you do start, and you start early. As you progress, you can seek supervision or indeed mentorship and get further research training, as I've already been described. The importance of building collaborations, we've heard from Arvind already, and the university partnerships are really important to getting access to the people who are experts in research. That might mean then you go on then to look for more time with job planning and funding opportunities. But ultimately, you need to embrace research and learn from the failures so that you can continue to grow and develop. Celebrate the success and ultimately enjoy your careers. Next slide, please. Thank you for listening.
Wow. Thanks, Richard, Arvind, Abby, for those really inspiring talks. And so not just inspiring, but also I think informational. We've got a real feel for those different pathways to having research involved in one's career. We've got a number of questions here, and the one with the most likes is ask a question about the benefits and negatives of doing a full-time versus a part-time PhD. Is there anyone I can certainly talk to that, but is there, from the supervisor's perspective, is there anyone who would like to pick that up from the recipient's perspective?
Yeah, I suppose I did a part-time PhD. It took me a long time. And, when I look at some of the NIHR awards that are available now, I can just go, wow, that's amazing. Like you've already highlighted, Debbie. I wish that was available in my time. What you probably find is anytime you split anything that you're doing something part-time, you probably find that each part consumes more than 50%. Okay, so that's one thing you've got to be aware of. And Arvind's already sort of touched on the fact that you start eating into your evenings or your weekends. And that's just the nature, I think, of possibly split posts, but also particularly ones that have a research element. One of the real sort of advantages, I think, of doing a full-time PhD is obviously clearly you can focus full-time on it as long as you have the funding as well as the time to deliver on it. And I think certainly when I was doing a part-time PhD, I was spending quite a bit of time applying for funding to pay for consumables. And it wasn't until much later in my PhD that I had funding actually that allowed me dedicated time. So I was trying to do it a bit like Arvind had described, and it's not a very efficient way of doing it, and it takes much longer, and it means you're a lot less likely to succeed.
Okay, so it sounds like your votes are for the full time. Having done a part, so I absolutely agree with that business. For when one splits one's time, it's never 50%, is it? One ends up giving more than 100%. I think the benefits of a part-time PhD from a number that I've supervised is that things evolve within healthcare, and we want whatever we develop to be responsive to immediate to current needs. And so having that time, sometimes the reflective time within clinical practice, and that then feeding in to the research can be a real positive. Whereas working at pace, working in those 3 years, that flow between clinical practice and academia sometimes becomes a bit disjointed, and it becomes very academic focused rather than the real healthy mixing of the two. But maybe for mental well-being, maybe the full time is better. Arvind?
Yeah, I was going to sort of comment on this because I'm doing the pre-doctoral as a part-time, and I've actually found it to be really useful in my particular situation. And the reason is because one of them, from a pragmatic perspective, is your CPD. as if you're going to be doing a purely academic role, it can be really difficult to write CPD. Your reflective accounts of things like how your practice has benefited your patients. So having the as I said, from a pragmatic perspective, it actually works out quite well. But also, as you said as well, your mental health. If you're, I've tried doing literally days on end where I'm literally just doing research and research and research, and you can get a bit tunnel vision, and it can make everything else seem a bit, it makes everything feel like it's less important. And actually having that break, and I don't mean necessarily just in terms of, this is your career, this is the research side of things, but actually for me, the mental break comes from the commute into work, the commute back from work, the listening to the radio, the listening to what's going on in the news, those lunch breaks that you're forced to take, where you're catching up on the news, C&D, PJ Online, all that sort of stuff. And I don't think if I was doing a full-time PhD, I would afford myself those opportunities. So having that split time actually for me has worked out really well.
Thank you. Thank you. So moving on to the next question. We've been asked about insights into what the day-to-day life is like, either doing a PhD or research. I think they are two different things, having an academic role versus a PhD. PhDs are pretty structured, and I think perhaps we've already got a bit of an insight into what that looks like. So you have your research studies that you need to conduct, and you're doing some writing in between. Having an academic role, I think, Richard, again, it would be nice for you to chip in with a slightly different slant on an academic role. Oh my gosh, every day the learning is like so logging CPD, not a problem. Super steep learning curve every day. So what my day would look like, so I will have a few projects that I'm managing, so I'll have the regular meetings about how that's going. Always problems, there's always new problems, and this is why it's such a steep learning curve. Every day I'll be, because by definition it's research, no one's done it before, so they're coming to me with, right, this isn't working, what should we do? There's the teaching, so that things like the CPD, so I get to teach behavioural science, I get to teach strategies for dissemination, I get to teach realist evaluations, all of those sort of methodological things. There's going out, doing talks. Yeah, that's kind of a typical day for me as an academic. Richard, what would yours be like?
Yeah, I think one of the nice things is it is so varied. I mean, you might have meetings where you're providing mentorship for people, advising them, not so much in the detail of the sort of aspects of the research, but more giving them sort of career guidance in terms of maybe their clinical development or their academic development. You might be developing a research grant where you're having to work with a team of people to get their views to make sure that the research is as good as possible, including speaking to patient and public colleagues to get their views to make sure that the research that you're designing is really the things that are important to people. Okay, and that's all really about minimizing research waste. You might be asked by a journal to review a paper that's been submitted for publication, and that gives you a chance to use your critical evaluation skills or appraisal skills to review the paper and to decide whether that's something that maybe with a little bit of refinement that is suitable for publication, or you might say no, it's not. So there's so much variety, and it's about, as you say, project management as well, because you're juggling quite a lot of different projects, and then you have things that come from left field that you weren't expecting, like maybe one of your own publications that you had submitted to a journal that's come back with major revision from 3 reviewers, and you've got 2 weeks to make those changes and to resubmit it. So it is incredibly varied, but you've got to be very good at prioritizing and handling several projects at the same time. And sometimes that can be a very heavy burden, and sometimes it can be very fulfilling as you actually tick things off your list and achieve more things as well.
Thanks, Richard. We've got a number of questions that are kind of around the topic of, oh, sorry, that just jumped. how does one decide on what research topic one's going to pursue? Abby, have you got any thoughts on that?
So this is definitely a question I'm currently exploring with my research proposal to write this year. For myself, I'm looking more at pharmacy technician practice within primary care. It's taken a bit of thought to get to, but one of the questions I get a lot outside of research is what can a pharmacy technician do within primary care? And that could be built upon in community pharmacy, secondary care. It can seem still a little bit of a grey area of where pharmacy technicians, the ceiling of individual practices at the moment, as we're constantly a developing role. Quite rightly, we're all growing together. So for me, I want to look at more primary care being where I am now, is what practices are other pharmacy technicians doing and how do we create best practice from that?
So your question is coming from your own clinical experience, questions that people are asking, and I think that is where it is most successful. It's definitely why I have kept a foot in each camp, so that when I'm writing grants, I know that these are things that are important at the coalface. We also have a question, and perhaps this maybe comes to Abby, maybe to the NIHR team. What does an NIHR pharmacy commercial research fellow do? Because I don't know.
I'd have to pass on that one.
Can anyone chip in? Humera? Perhaps this is something we'll pick up on afterwards, when we will go through all these questions and post answers. Okay, this is again, I think, one for the NIHR team about GPHC registration, so that's a technicality. Advice on getting jobs after a PhD. Who would like to pick that up?
I'd say use your network. So a part of your PhD should be on networking. And even at the pre-doctoral level, there's it's a really good show if you can show that you've done some networking. And don't be afraid of moving, I would say. Some people get very stuck. Oh, I've based my life in this particular town. I've based it in Oxford, for example. So I can't leave Oxford. If you're fortunate to be in a position where, whilst it may be uncomfortable, you can move, that might be the better choice. Obviously, explore working from home models. That can be really useful, especially now that we've got things like Teams, etc. But yeah, your network is probably your best friend, because all the all your network will. I mean, again, this is how I've done research projects. It's just through people saying, "Oh, by the way, Arvin, I'm doing this thing. How do you feel about doing it?"
Yeah.
And that's just how it works.
Research is one of the key elements of it is actually networking. It's going out, getting messages out there. So it is a great opportunity to then find new roles. Whereas with traditional clinical work, we don't necessarily constantly go out reporting our activities.
And I think what I would add to that, and I agree with that, I think you have to be prepared to sell yourself, because you cannot assume that the employers necessarily would value the skills and knowledge that is developed during a PhD. Now, I'm not talking about the particular subject matter of the research itself, but it's the sort of translational skill that I was talking about, those skills. And you may have to make sure you sell yourself and show how you could improve the services that are provided by the employer as well, because don't take for granted that they will actually understand that. And as Arvin says, you might need to shop around to do that, but be prepared to have that sort of elevator pitch and be able to say, this is what I can do, and this is how I can improve the services you provide.
Thank you. One of the most frequently asked questions, and we have answered it written, but I think it would be good to put this to the panel, is as a student, what is the best way for me to get some experience so that I can make myself a really competitive applicant for a PhD? Richard, do you want to come in with that?
Yeah, I mean, it sort of depends what stage you're on. Obviously, the earlier you are in your career, the less experience you have. And I suppose what you need to show is that you've got a passion. And I think Arvin talked about this, the passion for research, that you will bring the energy, that you will bring the work ethic that is needed, and you have enough interest in the subject and the resilience to actually see it through. So I think that if the supervisory team are good enough and they see those qualities in you, then I think it should work. I mean, you don't have to be, Albert Einstein just to do research. You've got to have all those other qualities. Because as I said to you, it's a roller coaster. Things hit you from left field, and you've got to deal with those and handle with them, and then work with them, be adaptable, be agile, and to actually follow in pathways that you thought, well, actually, I thought I was going to do this, and then my research actually took me down this other pathway. And so you've got to also be able to show that you're able to receive feedback and respond in a positive way. Okay. And that's what your supervisors are really, I think, looking for, in my experience anyway.
Yeah, and to get to that point of being able to secure a PhD, it's just taking proactively going and looking for opportunities to demonstrate that you're putting together a research portfolio. And that can even be engaging with audits, QI projects, writing those up and then presenting them somewhere. Just take every opportunity. And I wrote in the chat, think beyond pharmacy as well. Drawing from the other professions. We saw there in the stats that actually pharmacy, we've got a long way to go in terms of getting ourselves up and accessing the funds and developing our research portfolio. So access other healthcare professions and their supervisors to get your foot in the door with securing a doctoral fellowship.
I would say as well, just as an FYI, if you're a student and you're looking to get into clinical research, there's a really good book you should read. It's by Trisha Greenloff, and it's How to Read a Paper. And for me, as someone getting involved in clinical research, being able to read a paper and understand the contents and be able to evaluate it is one of the most important skills, because you will be reading papers constantly, and it's only through practicing reading them and understanding do you start to appreciate what good research is, what bad research is, and where the questions lie. I'll see if you I've got to see from Mariam. I will try and post it in the chat if that's all right, the name of the book.
Okay, I think we've picked up most of the questions. Yeah, I don't think there's anything in particular. Is there any, I don't know, can others see the chat? Is there anything, all the questions, is there anything that in particular that I've missed? If there is, for those that are in the webinar, if there's anything that I haven't picked up that you would like addressing, could you just upvote it so that it goes up further in the ranking? There is, okay, so there's one question about GPHC registration before applying for these roles. So there is variation. A significant proportion do say you need to be a registered healthcare professional. I think there are others that are a bit more. So, for example, the Insight says that you need to be a student rather than actually being registered. So I think go to the individual program. What I would say is the program managers for each of these are amazing. They're so responsive. So if you're not sure, email. There's always an email address and say, this is my unique situation, and they will then give you a tailored response. I think
there's one about securing a grant, Debbie, that's got a couple of votes. What does it mean by securing a grant? Well, grants probably, or if you think about awards, in two sort of main categories. One is a project grant, where you are funded to undertake a particular research program. And one is a personal fellowship, which is some of the pathways that we had described by Debbie earlier on, where you usually need to be a registered healthcare professional within the programs that are here. from a clinical academic perspective. Securing it means you actually got it awarded. So obviously you apply for many more grants than you get awarded because they're very competitive. And that's why you have to have these collaborations, these networks to get the teams together that are really got the expertise to be able to show the funder that these people have the right idea and they have the right knowledge and skills and expertise to be deliver on this plan. Otherwise, there is a risk of wasting that funding. So the securing means that it's been awarded, and roughly speaking, you've probably got a 1 in 10 chance, depending on the program, from something you submit to actually getting it awarded. And some of them have 2 stages. And for personal fellowship, some of them have interviews as well as the application. So it depends on which pathway you're talking about.
Thanks, Richard. I think, again, is there anything else that you want up voting?
There's one question from Nicola Lewis about engaging motivating secondary care pharmacy leadership team. So I'll tell you an interesting anecdote. I had this exact problem when I was trying to apply for my pre-doctoral program. So I approached my line manager with the project, and it was sent around the pharmacy department, and eventually it was rejected because they said that it's not something that they're interested in participating. You have to, again, for me, one of the important things when I started choosing my jobs from now on is to say, I'm research active and I want this to be a part of my role. So that you're honest with them from the outset. If you're someone who's going into research, there's usually someone in a department or one of the other adjoining departments, and it's worth liaising with them to see whether they've made a business case for a particular research. But usually, whatever it is you do, it has to be aligned with the trust's priorities. So it's always worth identifying an immediate question that you've identified through current practice, and again, maybe they'll respond positively to that. Or, again, they'll outright refuse.
Sorry, Abby, did you want to come in?
Yeah, it was just to answer that on a different perspective of GP practices as well. I know there was a question in the chat before of how do we propose research in GP practices if the practice isn't currently got it on their radar. And again, like Arvin said, for secondary care, it's preparing like a business case and funding talks miles in GP practice, especially with research delivery as well. That's normally got funds behind it. So it's seeing what you can reach out to locally. There are opportunities such as the wider care settings funding you can apply for if you are research active in a delivery capacity. So it's just seeing what opportunities are available.
Brilliant. Thanks, Abby. Eva, would you mind moving back to the slides? Okay, so first of all, thank you so much for really engaging. The questions have pushed us. And as I said, we will pick up on the questions that we didn't manage to cover. It would be really useful for us to know, as a result of this event, where you feel you are now, having told us what your starting position was. So we've got the options there of whether or not you feel now empowered to take that first step, whether you're still thinking, I need to think this over, but actually I'm considering it, or actually I'm still very unsure and I need more time and more information. Okay. That's really exciting. So we've got 39% that are feeling empowered to take the first step. And we will be able to provide you with further details of what those first steps might be when we answer the questions. And again, more time to think it over is really exciting. The fact that actually, as a result of this, you're feeling that the door is open to research. So think these are really positive outcomes. Thank you very much. So if we move to the final slide. Okay, so as I said, the Academy are really open to responding to queries, particularly when we said there are particular things like the insight, the pre-doc, there's also pre-application support funding. There's numerous pathways. Really feel open to contacting the managers, and they will be able to tell you whether or not it's the right pathway for you. We haven't really talked about Research Support Service, RSS, so please do go to them. They will be able to sometimes do things like guide you to supervisors, give you advice on which are the different pathways to apply for. So a lot of the the stuff that we've talked about, that uncertainty, Research Support Service will be able to help you, and that's funded by NIHR. And there are lots of other mechanisms for getting information. So thank you very much again for your participation. Huge thanks to our speakers, to Arvin, to Avi, to Richard. Really appreciate you taking the time to share your experiences and answer the questions. And hopefully this will be the first of many events that we can do for pharmacy professionals. Thank you.